Yeah. Hi, this is Dr. Arun More, and now through this series, actually, let me explain you how the doctor would attend the patient whose appointment has been taken. So just log into in your ID. Remember that there is always an the only patients can log in with their mobile numbers. For doctors, they have to log in with their login ID and the password generated. So that way it has to be in the system. The outside registered doctors, actually, the through the app, they it's very simple to remember the login ID, the first name, last name, first name dot last name dot doctor. So that is their login IDs through which they can get logged in, and password whatever they have generated, or by default if it is generated. So I'll just go log in into the system and move further. Over here, actually, you have this patient list. Now this patient list is of those patients who has taken up appointment with you. So I'll just open up this patient list, this one, and I'll go inside. So inside, actually, whenever you can see over here, you have these patients into your system. If they have their profile pic, they can be seen like this over here. The patients can be seen like over here. If we see over here, if you can see the first icon as referring, but by default there is in process. Then you have on hold, you have served, you have referred out, and you have a backlog. Now what is more important for you when you have this in process as opened by default in front of you? It does mean that the patients who has taken your appointment, they are over there online to get you consulted, either in your clinic or through the telemedicine, through your video calls. If you can see, you get the patient's name over here, then their age and their MHC ID, and this is their gender. So this way the patient's identification would be there. This particular number is of the leader's number, patient's number. They are from wherever they are, the address gets reflected. The leader under whom the patient has been appointed or given a hypertension leader or nurse, that nurses or hypertension leader's name comes over here, and their obviously mobile numbers come over there, and doctor has a direct access to this this numbers, and they can be called upon. You can see the refer button and view details button, two buttons over here. If you want to refer the patient to somewhere else, like from PSC to CSC to district hospital, or any other expert, or any of your doctors inside the institution, or anywhere else, you can just put the refer button and send out refer the patient from system to system. For timing for this particular appointment, let us go to the view details. I'll just go down to the view details over here. Let me tell you one more thing. You can search your patients from here. You can write down their names, and names, phone numbers, or anything else that can be searched upon over here. As if you remember in my previous series, how to take the appointment and the patient's appointment, you would have seen the patient's name as trial. This patient will go ahead. One pop-up is generated to confirm whether the patient is the same or if the patient is someone different. This particular pop-up has been integrated for a quality check, where we should not go wrong with the name of the patient or name of the patient. So confirm it out to go inside. If you see over here, there are some of the things what you can see. Let me explain it one by one to you, everything. So this is the screen of the doctor, where a lot of things are reflected, and let us go one by one. Obviously there will be my next videos where everything of the system, like these graphs, this what is prescription, what is forms, what is DI, what do you mean by reports, what do you mean by this icon or this icon. So every icon one by one will also be reflected and taught in the videos. So I'll just give a brief about this doctor's part, how exactly what it is exactly, and how the doctors can give the prescriptions to the patients actually. So let me explain you one. This is this is the video icon, and if you click on this, the video is started from the for the patient side. So I mean, I'm sorry, but this cameras will not work. Both the cameras will not definitely not work because recording is going on. But this is the icon of video call for the patient. And then what happens is, let me show you. What do you get the WHO ISS risk, and this whole screen is, I to call it as a dashboard. So this is one time bird's eye view of the patient. If you can see into this, you get the WHO ISH risk of the patient, and the risk is reflected over here. What is the patient risk, the diagnosis, or you will have to give entry upon the symptoms of that particular visit comes in, significant history. If you remember, I gave the history of heart attack, and hence the IHD has come over here. If you remember, while in my previous video, we have given the history of hypertension, diabetes, we have given the history of family history, and the smoking. So all this comes as a risk factors over here, and you have this end organ damage. If the patient has given history of heart attack, then end organ damage comes as IHD, and if the proteinuria, it comes as proteinuria as well. So end organ damage also is getting reflected in your dashboard. If patient is having any event like syncope or accelerated hypertension, those will be recorded over here if the patient has given history. This is the baseline blood pressure, the first blood pressure. Now this will never change. This is as per the first clinical form of the patient, it will never change. This is the target blood pressure of the patient. We have to reduce down the blood pressure up to this level, then and this is today's blood pressure. So as per the follow-ups or clinical forms, this today's blood pressure will be changing. You have the sugars reflected over here, the sugars, the fasting one, PP1, and the random one. You have HbA1c reflected over here, the weight and BMI over here, creatinine, which we have given the values into the clinical form, and these values were not actually much given. Urine in positive was given as positive. So this is generally the dashboard actually. If you want to diagnose the patient, you can diagnose like this. You can have to provide the diagnosis of the patient. You have this various diagnoses reflected into this system: the ischemic heart disease, the coronary artery disease, then patient is in rhythm, sinus rhythm or something else, then CKD, and if you want to give some other hypothyroid, then you'll have to submit your diagnosis over here, and when you add the diagnosis is reflected over here. So the diagnosis is over here. So this is bird's eye reflection of the patients, all the ailments and problems what they do have. So this is what actually you have. It comes at the first screen of the patient. You see the patient's name over here, gender, and then MHC ID. The visit number is reflected over here. The visit number is first or what, and if it is more than first visit, then when was the last visit, and first visit of the patient also is reflected over here. So this gives a very brief glimpse about the patient in as a dashboard. You can chat with the patient over here with the patient in a textbook chat. That is also quite possible with the patient, a patient to be chatted. Then if you see, there is a QR code of the patient. This is QR code of the patient. Many times to make the systems easy, you have your own mobile number, you have a mobile other mobile with you, you have the reception ID in logged in into this, and you can just scan this QR code and you will get a lot of information about the patient. These various icons, if you see, there is this referral icon. First is this one is the referral icon, actually, if the patient is needs to be referred to anyone. Second is with this icon, actually you can call to the leader. So the leader under whom the patient is, you can call to the leader, so to know about the patient. You have this hold button, actually, to keep the patient in hold for some time, till the time you have advised some of the investigations or anything else to them. So hold is there. This particular icon is for the finishing the appointment. It comes at the last, actually. If suppose the patient is at your distance and you want to call the patient, so this is for call patient. So if you click on this, then patient's mobile number will be appearing. So let me show you. This is, do you want to call patient trial. If you want to give a voice call or auto call, that call will go. This is simply refreshment, and this is home, actually. As we have not done anything else and appointment has not been finished, and if we click home, it will ask for the holding reason, and you will have to follow that. So let me come back after this brief description of the icons at the upper side and of the dashboard. Let me show you the other icons, which are, other things like graph, prescription, form. DI is doctor's interpretation. So interpretation, TATION. So interpretation, doctor's interpretation it is. And then obviously reports. The graphs, you will get the graphical presentation of the blood sugars and other things, whatever the values has been there. There is prescription. I'll be explaining this prescription part very thoroughly, briefly in this presentation, and later on thoroughly in my another video. You have these forms, actually. If you can remember, this is the clinical form the patient has been submitted. So if you want to update the values, many a times it happens that patient has given some wrong information, you need to update it, so you can update it over here. So these are the forms. This is the medical form, actually. Sometimes what happens, the patient has been given some wrong history and you need to modify it, then you can modify and you can update the medical history or clinical history of the patient with this form. And and one more thing, if the patient gives once information into the medical form, it cannot be edited from the patient side. It has to be edited only from the doctor's side. So these are the some of the forms. Then there is one quick form where you can give the various inputs like blood pressure, blood sugar, weight of the patient, or episode if the patient had anything, if the patient has done any TMT, if it is positive, negative. Then some of the blood tests, as we have given in the clinical form. The 2D echo you can give over here, actually. So 2D echo report also can be submitted of the patient. So this way the quick form is there. PH is the physical examination form. It needs to be given at least once, especially for the telemedicine patients. And notes, I'll as you go ahead exploring the app and seeing into the prescription and giving the inputs of the notes and various information to the app, actually you will get to know what are all these things, actually. So these are the forms of various patient of the patients of various forms. Then this is doctor's interpretation. Now this doctor's interpretation is exactly how we write down in our prescription papers, like patient is known case of hypertension, but he was non-COMTL compliant and now wants to get evaluated. Okay, so these are some of the notes, actually, what we are writing. You can submit it out, you can generate your own templates as well. I'll show you this, how to generate the templates, and templates can be inserted over here straight away like this, and these particular notes are being saved like this. Now these notes are being given generated in the PDF prescription at last. So be careful what you are writing, because these are the notes, actually, what we write down on the paper. This is self note actually. So self note is so sometimes we need to remember that what we told this patient last time. So into the next follow-up, we can generally ask the patient that have you done this or not. So if I tell them do 2D echo, then what happens if whenever this patient comes for the next follow-up, there is one pop-up coming in, okay, oh, last time I told this patient to be done this, or we need to remember something specific about this patient, like I found renal brew into this patient. So this is one specific patient we need to remember. So you can just submit it out. Next time this will be the first pop-up, and you will remind, yeah, that was this patient or something like this. So event and compliance, we ask about any event, any hospitalization, non-hospitalization event, or death of the patient, and that way actually we just document the events happening with the patient. Compliance to the patient, we generally do ask. Then compliance to the investigations, we have asked. Salt reduction and exercise, we do ask into this. So we'll have to submit this event and compliance with every consultation finish. So the consultation will not get finished unless you have submitted these events. So that way actually the things comes up. You can just report the ECG, whatever the ECG will be there, to the end organ damage. If you have any end organ damage, you can submit it out for the patient. Retina, you'll have to submit it if retinopathy is there, hypertensive or diabetic. Target blood pressure you can set, and then you can give the entry of the TMD as well, whether it is positive, whether it is negative or inconclusive, something like this. So this is what the doctor's interpretation is there in, and under this actually all our notes as a doctors get saved, and those things. So I'll go to the reports. Reports over here, you can see a lot of folders of the patient over here, the kidney function test, ECG test, or anything else. If the patient has uploaded any of the ECGs or any of the reports from their side, then the patient, you can see their reports over here. Just now I uploaded one ECG for the patient from my another handset, and if I can see, this is the ECG of the patient. So ECG comes over here, we can zoom out, zoom in, and check out for the ECG, any changes or anything, and then comment about it as well. So this way actually you can see under the reports of the patient. And if you go into the doctor's interpretation and ECG, this is the ECG you are seeing over here. There is definitely an LVH over there, and I can write down LVH with significant STT changes and submit it out. So this is the last ECG impression of whatever the ECGs were recorded. This way actually the reports, the doctor's interpretation, the forms of the patient, the prescription, the graphs, and dashboard works out. Let me go briefly into the prescription now. I'll go to the prescription. The diagnosis of the patients get reflected over here, so you don't have to remember the diagnosis of the patient, what it was and all. It gives a personalized treatment options also for the patients, for the particular patient. So you have personalized treatment also of the patient, and you can add the diagnosis over from here also of the patient. This is the list of old medications. If you remember, we have given the amlodipine tablet 2 times over here, the aspirin tablet, the diabetes medicine. If you want to add any of the previous medications, so you can add up also the previous medications over here of the patient. So you have the old medications over here. You can generate templates of yourself, that is also possible, and then select it multiple templates as well. I'll be having a separate video on generating the templates and this complete prescription part, so you can add up the medicines from your prescription part as well. Now let me come to the add RX, that is go for the medications. If you can see, there is one this icon over there. There is category, there are medicine, then there is dose, there is frequency, there are days, and then you have a plus icon and add in prescription. So let me explain you one by one what it is exactly and how it is important and all. So this particular icon says that if you want to edit it, so before edit what is available, I'll just let you know. You can choose the category of the medicines, like there is hypertension, there is diabetes, there is heart failure, painkillers, and all these categories are there. So if I choose hypertension as category, I just go ahead and choose the medicine which are already feeded into the system. I'll choose the amlodipine one, and then there will be some doses of the particular medication, the minimum doses, the and maximum doses, so that there will not be any dosing error as such. And you choose the medication dose. Also, you can, if you can see, there is a by default frequency. So this is the mostly used by default frequency of the patient, but if you want to change it, you can change it as per your requirement or as per the patient's requirement. By default it comes as to the 30 days, but if you want to make it change, you can change it. If you want to add another medicine over here, if you have gone to add another medicine over here, and if you see this particular icon, particular icon means editing icon. So you don't have to choose any category over here. If you go like this, so you just have to select and unselect for that. If I select like this, and then I can type it tablet Womikind like this, and dose, suppose if you have 4, frequency you can make it anything else, or once a day, something like that you can choose, and then add into the prescription. So if you add the medicine, and if you have seen, you added over here, and then after clicking this add in prescription, the medicine has come over here. So this way the prescription is getting added into the system. You can delete it if you want, and this is like an ongoing prescription of the patient, whatever it is has been given from us. So this way, select the category as such. If you have very many categories over here, you can search the category here as well. But before going ahead for the medicine, you have to choose any of the categories, suppose like this. And if the medicines are not found, it reflects medicines are not found. Let me show you. Heart attack medications, you will get antiplatelets over here, the clopidogrel over here, the minimum dose, maximum dose will be there, and that can be added into the prescription. So this way the prescription is added for the patient. You have one of the option by default, generic medicine selected, or generic or branded. If you keep this open, then the particular brand name which has been given by our system, that is reflected into the prescription. So this way the prescription is generated, and then submit it out. After while submitting it, advises it ask for any advice to the patient, exercise or get HbA1c done, get it done, something like this. You can give the entries upon. You can use the templates also. What you have the templates, you can set by default the templates of yourself, individualized one. Address for the leader, keep a watch on the taking, if the patient is taking medicine daily, keep watch on sugars, keep watch on exercise, yoga, check BP tomorrow as well, something like whatever you want to let the leader know. This is the problem with the patient, and keep a watch with the patient. So this way actually advice for the leader you can give and keep it. Follow-up date is important, you have to give, because auto calls goes as per the follow-up dates to the patient, and submit it out. Then a prescription is getting generated for the particular patient. If you can see the prescription, so this is the prescription, the next follow-up date and all, and then you can share the prescription via PDF through your email, through your WhatsApps or any of the system, or what we can whatever is possible. So it and some of the as our app is completely connected with the internet continuously, that matters a lot. And suppose I go like this, and I open it up. So I just go into the system and give a PDF. You can find this PDF. So this way you can find the PDF of the prescription. You have the patient's complete data into the system. You have QR code. Then you can check out the date and time of the patient, visit number, everything. Next follow-up comes up. The dashboard as it is reflected over here. If you can see, the target blood pressure, today's blood pressure comes up, HbA1c comes up, everything comes up. Your notes, patient is known case of hypertension but he was non-compliant and wants to get evaluated, this has come over here. So PDF is generated. Exercise in HbA1c getting done is advised over there. This is the prescription generated of that particular patient, and if you can see, the doctor's registration details are over there. With this QR code, app can be downloaded, and this upper side QR code, this particular QR code is for of the patient, and under whom the patient is under the leader, that ID comes over there. So this way actually it's very simple. So it's very simple that and how the things, the prescription is shared and PDF is generated and can be shared across the platforms. So at last, let me tell you one very important thing, that suppose you are consulting the patient and you need to keep the patient in hold. You have asked the patient to go and get ECG checked or get something done, then you can put the patient on hold by saying that ask to get ECG, so and then submit it out. If you can find the patient comes in your on hold under the on hold icon. So patient is over here on hold, and the reason over here reflected is the ask to get the ECG done. So the patient is on hold for the whatever the time it may be, there is reflected over there. And if you want to again go ahead to check the patient and check out the details, then just go inside. Now the view details will be there, and you can manipulate or you can do your work with the patient again in whatever way you want. And lastly, you have to finish the appointment now. So the finish the appointment, it's very simple. Just go for the finish appointment icon, which is this one, finish appointment icon. Go for this and finish the appointment is finished, and the patient is logged into the served area. So this way it completes the complete cycle of appointment and the prescription. Thank you so much, and I'm sure this MH Clinic app would help you in keeping your patients all the records at your eyesight all the time through the mobile phones of the patient and yourself also. Thank you.